Adam, and I'm very excited here to be giving you this webinar. I'm going to be talking about X39 and how I really brought it to my practice, and I think you're going to find this to be a very thought-provoking presentation and this journey of how I added this. So first of all, my background, I think it's good to know where your speaker is coming from. I come initially from the Northeast. I went to college at New Jersey, Rutgers. I did my medical school at the University of Pennsylvania. I did my residency there, and I did a fellowship in Oklahoma City. I've been in private practice now for the past 24 years. I am a Wall Street Journal best-selling author for this book that I put out called The True Definition of Beauty. You can get that on Amazon. I am an international speaker and trainer, and I have a worldwide practice, and I think you'll find it interesting about why I have this practice. So, you know, a lot of us have physicians and practices that are in one area. People come around the globe to see me. Let me just tell you a little bit about why is that the case, and then why did I add X39 to my practice.
You know, our Dr. Joe's done several stories about people from the Bay Area who go overseas for surgery. They find it to be cheaper. Now we're seeing the reverse. People coming from other countries here to the Bay Area for medical procedures. Why they're doing it, coming up.
How far would you travel for the best health care in the world at the best price? Dr. Joe has shown us how patients from the Tampa Bay Area have been going to other countries for low-cost procedures. And many of those connections are made on the internet. But she has also found the opposite is happening as well. It's a kind of reverse medical tourism. Dr. Joe tonight is going to show you how hospitals here in the Bay Area are now attracting patients from many parts of the world.
While big facilities like the Mayo Clinic and Johns Hopkins have an international edge, niche surgeons in our own backyard are attracting patients from as far away as Singapore.
I've got some fat deposits kind of on my cheekbone here.
Look over this way.
At 31, Emma Claxton's tired of looking tired.
And I'm sick of people saying to me, you should get some sleep. I just like to have a day where that goes by and people don't say that to me, and I don't look in the mirror and go, why have I got these eye bags?
Her online search led her 30 flight hours away to Dr. Adam Scheiner.
This shadow that's coming down here that we would call this festoon.
Dr. Scheiner's international reach began accidentally.
In my case, I wrote a book chapter about this idea of festoons, and the people who were editing the book, they said, would you put together a video for us? And I put it onto YouTube for the editors to see. And you know, within a day, it was all over the internet.
Now, 80% of his patients travel here for medical care. The doctor's office handpicks lodging, in this case, Tampa's Sailport Suites.
I thought I was going to start with something with one room a month, and here we are.
Christina Overstreet arranges accommodations. Thanks to visiting patients, she's booked an extra 350 nights a year. She's now seeking to partner with other doctors. We met up with Emma there 10 days after her procedure.
Very happy with the condition of the skin. Still a bit sore and a bit swollen, but considering it's only 10 days after the operation, it's been very, very fast recovery.
Minus her festoons, Emma's going back home after tasting Tampa's culinary treats.
I went to Burns Steakhouse, which was fabulous. I went to the Bahama Breeze over there and went to an IHOP because I never had pancakes for breakfast.
So I think you'll find that interesting. So yeah, I have international practice because of this idea of festoons. I'll talk about why that is. And once again, I'll then go into how I am using the X39 in my practice. So talk about this book, The True Definition of Beauty. How does the human brain evaluate the face? There was a article put out by a colleague of mine named Jejmed Khan called Aesthetic Surgery, Diagnosing and Healing the Miscues of Human Facial Expression. In this paper, he was talking about the face as an organ for communication, and the interpretation of facial messages is innate, meaning we don't have to think about it. It happens automatically when we see each other's faces. Sometimes through birth and sometimes with age, our face can change in ways that can be inconsistent with the messages that we want to send out. And so much of facial surgery is concerned with realigning these facial messages to be consistent with how we feel inside. There was a book called The Science of Beauty by this colleague, Nancy Eckhoff. She's a PhD and she's at Harvard. She wrote this book called Survival of the Prettiest. She was looking at society and how beauty has been, the effect it has on society. And the importance of beauty has been recognized through the ages. When Aristotle was asked why people desire physical beauty, he responded, no one who's not blind could ask that question. According to Dr. Eckhoff, also, we evaluate each other all the time based on appearance. And they know this in a nursery, that cuter babies got picked up a little bit more than the less cute babies. And then I think this is true. If we find someone attractive, we want to please them with no expectation of immediate reward or reciprocal gestures. So what are the characteristics of an attractive human face? We always say it's the eye of the beholder, right? And I think that's part of it. But I want to talk about another part of really evaluating attractive human faces and beauty. And this has to do with mathematics. So I want to take you back to the 1200s in Pisa, Italy. Now, Italy wasn't Italy then, it was these city-states. But there was a person there named Leonardo Fibonacci, and he had mathematical inclinations, and he was from an upper middle class family. He actually went over to Asia and India and brought back mathematical concepts to Pisa. And he put together this book called the Bacci. He came up with a sequence of numbers to really analyze the multiplication of rabbits. And I was really excited. We made a trip to Pisa years ago, and my wife was very interested to see the Leaning Tower. I was very excited because I got to stand next to this statue of Leonardo. So his sequence goes as such: 1, 1, 2, 3, 5, 8, 13. And the way you get this sequence is you add the first number to the next number. That gives you the next number of the sequence. So 1 plus 1 equals 2, 1 plus 2 equals 3, 2 plus 3 equals 5, and so on. They noticed that when you divide these numbers by one another, it comes up with this ratio of 1 to 1.618. And they start to notice a lot of things in nature had this ratio. So the internal parts of a flower to the external parts of a flower had this ratio of 1 to 1.618. You can define a curve according to numerical sequences, and that curve in red is shown there. And they notice that curve matched the curve of the nautilus or the curve of the helix of the ear. So they thought this was divinely inspired, and they did a lot of art and architecture. So the Parthenon, Notre Dame, Mona Lisa's face, the Last Supper were all painted or constructed with these ratios in mind. Well, you can evaluate faces this way too, and what they found is that regardless of ethnicity, the more a face had in balance with these ratios, the more attractive we tend to see those faces. And let me show you an example here in a bit. So that is mathematical beauty. Then there's objective beauty, and we look at our icons. Okay, here's Marilyn Monroe, and the media has this roving eye and kind of influences it, shows what society sees as attractive at that time. Here we have Julia Roberts. She has a lot of the characteristics of classic female beauty. She has a short, smooth forehead going to a smaller nose, and she has a gull-wing shape to her brow. Her nose is smaller, so her eyes seem farther apart, and she has a more tapered jawline. Brad Pitt does not have a tapered brow. He has a more straight across brow. His nose is bigger, so his eyes seem closer together. He has a more square jaw due to chewing muscles called masticatory muscles. And it's too bad they broke up, but here we have Brad Pitt and Angelina Jolie. He has a straight brow. She has an arched brow. His nose is big, so his eyes seem closer together. Her nose is smaller. Her eyes seem farther apart. He has a more square jaw and more tapered jaw. So what I want to take a look at here, this is a pair of photos. And if you look at these pictures, which one looks like the man, which one looks like the woman? The one on the left looks like, I can see the comments there, yes. The one on the left looks like a woman, right. And you didn't have to think about that. It just looked that way. Turns out it's actually a picture of the same person. And what they did is they digitally darkened the eye and mouth region in the picture on the left, and that makes our subconscious brain see a face as more female. And so women, you have more vascularity to the lip region and eye region, and that's how we determine femininity. Men, we have more unicolor. Women have more contrast to their faces. And women know this. Jessica Biel, the actress, she'll put on lipstick and eyeshadow, and other women will too, to increase their femininity. The eyes are really the window of the soul. We kind of look at the eyes first, eyes and mouth first, kind of the skin and facial contours second. There's actually a talk I heard by a colleague named Daniel Lam, and he was one of the first people who did the face transplant on a woman. And he was talking about how important the transplant is to really work on the eye and the mouth region. And that's the most important part of how we determine who a person is. And that spoke to me because when I do procedures, helping the eye and mouth region and what I prefer doing. So they said, if you take this part of our former president and you put it on someone else, does your brain still see to a certain degree our former president there? I do. And you know who that is underneath there, right? Brad Pitt. So there's subconscious levels here going on of how we evaluate things. Jamie Lee Curtis is an actress who said, the first thing I look at a woman is her soul, and then I check her eyebrows. So this patient came to see me, and she said that everyone said that I look stern all the time. I did one thing to her, and actually was able to raise her brows, and you see how much more approachable she sees. Let me show you something. Remember the curves I was talking about, the Fibonacci curve? If we put that there, do you see how that brought that curve back? That's why your subconscious brain likes that better. It's part of this mathematics. And so we are very social beings, and we constantly evaluate one another for communication cues. And our faces are a big factor in our nonverbal communication with others. When I'm speaking to you, 7% is the words I'm using, 38% is my verbal tone, and 55% is the nonverbal communications, facial cues and body cues. We see each other, look at sort of the eyes and mouth first and the skin facial contour second. And our subconscious brain then tells our conscious brain how do we feel about what we saw in those areas. Aging changes around the eyes and mouth can convey an impression of being tired, sick, or less vibrant. Improvements to the eyelid region, skin and mouth can have a positive effects on the way others perceive us, such as wearing makeup, wearing flat glasses, take advantage of these two powerful areas for nonverbal communication. With age, though, sometimes makeup and glasses aren't enough. That's why people come to me for help with my expertise. Now, there's new research going on, as well as lawsuits alleging appearance-based discrimination. It's raising awareness of how our appearances look or help or hurt careers. And there was research done by the Federal Reserve Bank of St. Louis. I thought they dealt with monetary policy, but actually, in this case, they actually were looking at the links between appearance and wages. And they found if someone had an average appearance, and someone had above average appearance, they earned about 5% more. Compared to an average appearance, someone with below average appearance earned about 9% less, or about 14% difference between these two extremes. This is something I think we know intuitively, but there's actually science behind it. So these pictures, what they did is they constantly changed this photo to be more consistent with those golden ratios I talked about, the Fibonacci ratios. And if you look at these photos, this was actually done in Germany. They had 10,000 university students evaluate these photos and say, what are the two photos they like best? And then we'll ask you, what two photos do you like best? I could see in the comments here, yes, exactly, 5 and 6. 100% of people chose 5 and 6. And you don't have to think about that much. That's your subconscious brain affecting your conscious brain of how you evaluate faces. The next thing I want to talk about is our skin. Our skin is really our largest organ. Its job, and we think about the liver being an organ, the heart organ, the lungs are an organ. The skin is the largest organ. Its job is actually protection. It protects us from temperature, infection. It's a big organ for sensory input and makes vitamin D in the sunshine. So this is a little bit of a clinical slide that I'm going to show you. But so if you look at these two layers of the skin, we have the skin has the top layer called the epidermis. You see that purplish layer there? That is actually a living layer. It's called the basal cell layer. And that cell, if that's healthy, all the copies above it are healthy. If it's not healthy, the copies of the dead cells above it are not healthy. And then the dermis is where we have elastic fibers and collagen fibers. So our skin ages because of passage of time and sun exposure. There's intrinsic aging that has to do with genetics. That's the passing of time. And premature aging, the biggest thing is photoaging. Sun protection is the single best way to help prevent skin aging. Now, if you look at this picture here again, when the sun comes down on the earth and shines on us, we actually have visible light that allows us to see one another, and there are invisible rays called ultraviolet rays that affect us. UVA, it's shown in blue there, is a very long wavelength. It allows it to penetrate very deeply in the skin, past the epidermis into the dermis, where it fractures collagen and elastin fibers, allowing the skin to sag and droop. It's present all day long from sun up, sundown, and can actually penetrate clouds and car windows. So in a car, you're not necessarily protected in a car. UVB creates sunburn, B for burn. UVA, A for aging, B for burn. And it's most prevalent from about 10 to 4 p.m. And UVC is toxic to life. Thankfully, it's not absorbed by the ozone, doesn't really come down to us very much. SPF refers to, it's regulated by the FDA, it applies to protection from UVB. Recently, we have a consumer measurement for UVA. We want things that are broad spectrum and water resistant. You want to cover both those rays. And you could wear it every day because every time you're outside, you get a little bit damaged, even from you walk from your home to your mailbox or when you drive a car. This woman, actually, she was a migrant worker. How old does she seem to you? In the comments there, I could see, yeah, 100, 120, 58 years old. Yes, I know, it's amazing. She was American Indian. And this gentleman, yeah, he's 50. Yeah, he looks almost 50. He's 78. And he's actually a Tibetan monk, so he spent most of his days indoors. This picture, or a pair of photos, I heard about this patient is that she worked in a corporate environment. She went through rose through the ranks of her corporate environment. She got a new office in a corner office, and the sun would come and warm her cheek. Do you remember what ray actually comes through windows? Yeah, in the comments there, yes, this is, sorry, back here. This is UVA damage over time. That's exactly right. This is actually a picture of an Australian truck driver, you can see how his two faces were affected differently by the sun after a career of driving a truck, and that's UVA damage over time. And I actually split the photos and then double them. This is what the skin would be like if both sides were affected by the sun or both were not. Okay, so we have sun damage. How do we fix this? Well, I use lasers and actually remove the sun damage, and the body can then grow back new skin. And this is where the X39 comes in. I'll talk about in a little bit. I call it reset skin for skin damage. There are skin lesions that can occur due to sun exposure, such as basal cells and actinic keratoses, 10% of which go on to form squamous cell carcinomas. Sunscreen can protect against both of these. This is a patient who taught me something. She actually had surgery to raise her eyelids and to work on the lower lid bags, and I used laser to clean up the lower lid skin. You can see it looks a little bit cleaner, less spots there. She came back to me 2 years later. She was erupting in skin lesions everywhere except for the area underneath her eyes, and this taught me that not only was I making the skin look better, I was actually making it healthier. I then treated the rest of her face. This taught me that I can actually help people not only look better, but actually be healthier too. I've done a lot of media, and I was actually featured on Dr. Oz for this idea of festoons. And this is the festoons that we have here. And once again, I'm going to wrap into X39 here in just a little bit. But here, let's watch this for a minute.
Welcome to The Fix, one of my favorite problem-solving shows, because it helps you look younger and feel better about yourself. But today, we've got the biggest breakthroughs, the most astonishing advances, the ultimate fixes for your most hated age-related problems. And the first fix is for the problem that all of us will face as we age, eye bags. But now, there's a cutting-edge procedure that banishes bags in no time, and the results will leave you speechless.
My name is Dr. Adam Scheiner. I specialize in eyelid and facial plastic surgery. Okay, got that fullness there. Donnie?
Laser eyelid and facial plastic surgeon Dr. Adam Scheiner is here. Adam, welcome to the show.
Well, thank you so much. We're going to start here. You see this green color of the avocado, and we're going to compare that to the top layer of the skin. This is the first layer that I go through.
Please join us. Come on out. I mean, that is spectacular. Spectacular. Congratulations.
How are you? It's great to see you.
Come out of seat. Dr. Scheiner, congratulations. Wonderful work.
So that's really how my practice took off. I then got on the doctor's TV show for a similar thing. This woman, Erin, she had festoons. We were able to help that. And with these two shows, that's why I have this international practice. In any case, I'm going to go over some before and afters, and I have my own proprietary healing protocol. Let me show you what this reset procedure can do for sun damage and for wrinkles as well. So these are kind of shocking images, but this is what we can do with this sort of procedure. You can see her on the side here, almost looks like her younger daughter to a certain degree. But we can actually help people with sun damage, wrinkling. You see how that looks much better on this gentleman. We do it for men too. Almost looks like his younger brother on that side. This woman has these deep, deep lines around her face, and there's no skin cream in that, but with the laser procedure for the skin that I do, the reset for skin, I can actually make the skin better. Here's another example. You can see how much fresher her skin looks after we've done this. She actually was sent to me by her dermatologist because she was constantly freezing things off her face. And now afterwards, she doesn't have to do that because the skin is healthy now. Okay, so I've actually, over the years, tried to find ways to heal my patients better or faster. And I've done a number of studies using traditional cell membranes, O-to-beta-glucan, collagenases. Now, there are a couple of things that actually have been proven to work. One is called amniotic stem cells that absolutely worked. There was a company out of Santa Monica called Sky Orthobiologics, and I used that on a patient and actually worked to heal them faster. Hyperbaric oxygen also, a series of them can help heal people faster and helps with swelling. And X39 stem cell activity patches is my new thing that I'm using now to heal people faster. Let me show you about this. So this is now some before and afters of patients, and let me show you using the X39 how this helped. Now I want to state first of all that LifeWave is not to treat any specific diseases. We don't say it's designed to treat any specific conditions. So this is a disclaimer, okay? I'm finding this helps my patients, but you really have to talk to your own doctor about these things. But this, I'm showing you that in my practice, this is working. So these are 3 patients you can see without the patch, with the patch. So we have 2 patients with the patch, 1 without, and let's follow them forward. This is beforehand, okay? This is 6 days after. Now, without the patch, you see that redness? That's what I'm used to seeing in patients. Now, with the patch, this is 6 days after. Look how little redness there is in the face and less yellowing of the skin. And here we are at 10 days after, and I have to say, at 10 days, you see that redness on the skin on the with the patient on the right without the patch, and the people with the patch, they're almost healed at 10 days, and they almost look like a patient a month after surgery. Let me show you this. So these patients look like a month after surgery, only 10 days after, and this is the power of the X39 patch. These two patients were actually using it for a month before the procedure. And here we can see the way that 10 days look like in these patients with the patch looks like 5 weeks without the patch. So they're healing much faster. And I want to thank you so much for your attention. I have a book on Amazon called The True Definition of Beauty. It's a Wall Street Journal bestseller. And if you're interested in part of the talk that we had here, you can definitely get that yourself. And thanks so much for your attention. Okay, continuing on with our presentation now, we're going to talk a little bit about photobiomodulation and the X39 patch. So I thought you found it very interesting, my first talk, talking about how I introduced it to my practice and how it's helped people heal faster. Let's talk about the science about this, of how does X39 actually work. So there's actually a study done, a research done with the Connors, Caitlin Connor, Melinda Connor, David Yu, Jens Eickhoff, Susan Wagner, and Amy Chang. It was published in Internal Medicine Research at that date in that volume. This was the paper. It was a double-blind testing of a patch to determine if it could affect copper peptide production. And it was double-blinded. It was randomized with people not wearing the patch and with the patch. And over about a week, they checked the copper level in the blood. And it's actually presented to the U.S. Patent Office because it was so innovative. They're getting a patent for this technology. So 60 people were randomized in two groups. One tube of blood was drawn. And there was a significant increase in the copper peptide found when compared to the controlled group. And then more was taken at 24 hours and 7 days, and actually showed even more of an improvement. So let's just talk about, not about the study, about the X39 necessarily, but first about copper peptide. So it was first isolated by Dr. Lauren Bacart in 1973. It belongs to a group of emergency response molecules, which when we have an injury, these are produced, and that recruits healing cells to an area. And it's naturally to any injured tissue, and it's shown to have a therapeutic role in age-related neurodegeneration and cognitive decline. This is interesting. So I'm not talking about X39 now, we're just talking about copper peptide. Copper peptide, which we've been showing that X39 actually increases, but let's talk about copper peptide itself. Actually helps people with diabetic neurodegeneration, like diabetic neuropathy, and helps with axon survival and the maintenance of nerves. So that's very interesting. It activates stem cells, accelerates wound healing. I was showing you that before in my study. It's beneficial for hair, skin, nails, both growth and repair. It tightens loose skin, reduce fine lines in the depth of wrinkles, and smooth rough skin. So what are some of the actions of this? Well, number one, it's antioxidant, anti-inflammatory. So we've heard about inflammation being a problem with aging. How much would we like to decrease inflammation if we could take a pill through this? What if just a patch could do this? We're not really talking about the patch right now. We're just talking about copper peptide. There's a lot of research on this. This antioxidant is anti-inflammatory. This is interesting, but it beneficially alters the expression of human genes for nerves by 15%. So we have a set of genes, okay? And neuron function is set by these genes, and this can actually turn that neuron function on by about 50% better under the effects of copper peptide. And it induces strong anti-anxiety, anti-aggression, anti-pain activity within 12 minutes in a study of rats. I've actually seen this in my patients and in a colleague where a colleague of mine put a patch on him. He had problems with back pain. 3 hours later, his pain was down 75%, which was amazing. And we've actually seen a lot of people say, they put it on and they feel calmer within a few minutes. And that's why, because copper peptide, okay, we're not talking about the X39 right now. We're going to get back to it, but copper peptide, if you could somehow increase copper peptide, you'll have strong anti-anxiety and anti-pain. And that's kind of what the patch is doing on these two examples that I mentioned. So we never want to have a case where we have an intracerebral hemorrhage, because what happens is nerves die. That's what apoptosis means. But if they have high levels of copper peptide, less nerves die in a case of intracerebral bleeding or hemorrhage. It's implicated in resetting almost 4,200 genes to a younger, healthier state. How amazing is that? If we could find something that could make us younger, and this is any medication, this is a patch that increases copper peptide that does that. And copper peptide is the #1 bioactive compound recommended for the treatment of lung disease, COPD. We'll talk about that. It resets the programmed cell death in several types of cancer. Okay, now we're not going to make any medical claims here, okay? But the research has shown, so in a cancer situation, if I'm a cell, the cell to my left of me, to my right of me, in front of me, and back of me, on top of me, and behind and below me, actually tell me to stop dividing. Say, hey, we have enough cells here. What happens is, if I'm the cancer cell, I keep multiplying. I'm not really encumbered by all these cells around me. And if you have high copper peptide, it actually tells that cancer cell, hey, stop multiplying, and actually you can die at this point. So it's not saying this cures cancer, but in research it's been shown that this happens. And we've never seen any side effects with this. Sometimes people say that they feel maybe a little more tired or headache or something. That's usually just pushing out toxins, but the copper peptide itself really has not shown to any side effects or issues. It's been used in humans for the treatment of damaged spines segments in the neck. So we're just putting it on the skin, the patch, but they've actually had it in injections, copper peptide. They inject it around the damaged area, and they've actually helped fuse damaged spinal segments. And this is interesting. This sort of complicated sentence about alginate hydrogel. So what they're doing with mesenchymal stem cells, MCS, okay, they're trying to have bone growth happen. And they'll put a gel on top of the broken bone. And they found that with elevated copper peptide, you have more enhanced ability to regrow the bone when it's put on a broken bone. And increases healing speed of, here it is, skin, stomach, intestinal lining, bone, and tissue. It strongly chemotracts capillary cells, mast cells, and macrophages. So if we have a lot of copper peptide in an area, it says to the capillary cells, hey, come over here, grow this way. Come on, mast cells, macrophages, come over here, start working over here. And that's ways that we can get faster healing. I think that's what's happening in my patients when I do these procedures, why they're healing faster. We have a gene set that is set for cleaning out the cellular debris, something called the ubiquitin proteasome system. And if you have a lot of copper peptide, okay, not talking about the patch itself right now, just if you have a lot of copper peptide, the research shows that it activates the genes to clean out our cells. Well, who doesn't need a cleaning out of damage in our own cells? I do. Cortisone is used for inflammation. So people use it in the joints. The problem is when it's injected into a joint, it reduces any regeneration during that time period. But if we have high levels of copper peptide in an area and then you inject the cortisone and there's a lot of copper peptide there, it blocks the cortisone's anti-regeneration effects. You get the good effect of reducing inflammation without the bad effects of preventing healing. Fibrinogen is a top predictor for cardiovascular and heart disease. And if you have a high level of copper peptide, however you get there, you're actually going to have reduced fibrinogen synthesis. So this actually helps heart disease. And also, with people with heart failure, it increases myostatin. So it's helpful for the ninefold. Amazing. So it actually, if you have high levels of copper peptide, however you get there, if you're injecting it or you're drinking it or whatever, you're not drinking it, but the patch does this, but I'm not trying to cone on the patch just yet until we complete the slides with the study. But if you could ever somehow increase copper peptide, you would actually help your heart in multiple ways. And here we are. If you go into PubMed and you put in copper peptide, you're going to find 124 results. Okay, 13 pages. You can read each one. These are all studies looking at copper peptide. That's what I'm saying. Copper peptide does a tremendous amount of things. If we could ever somehow, and we know how, if we could ever somehow increase copper peptide in our body, it has all these incredible downstream effects. So this is the one talking about wound healing in mice. I talked about angiogenesis. I talked about how it recruits vascular cells into an area and say, come over here and help me multiply and grow into this area. That's what I was talking about. This is another one talking about, this is seen here, the NF-kappa beta. That's a molecule that has to do with aging, and it suppresses that. It does a lot of things. This is Lauren Picard publishing in 1918. They're the ones who initially put together this study on copper peptide. So what did the research show? A significant increase of copper peptide in the blood of the active group was seen with a significant p-value. P-value has to do with whether something is better than chance. And a p-value of 0.03 is very, very significant for it not being just due to chance. This is really an effect of the patch from day 2 to day 7. It looks like it took like a day or so for it to increase the levels for it to be seen, but from day 2 to 7, we saw that. So when you put it in the skin, what happens? Well, just like sunlight can cause changes, right? It makes us make vitamin D in the skin. These patches can do a similar way by increasing copper peptides. Put on the skin. It reflects back our own infrared energy, and that infrared energy will cause an upregulation of copper peptide, recruit stem cells to the area, and then they go throughout the body wherever there's inflammation, helps heal that area. So here's just a summary to skin and hair. It helps with wound healing. I showed that before in my former presentation. It smooths rough skin, reduced photo damage, models hyperpigmentation. We can't say it really helps cancer specifically. The patch does, but copper peptide has helped people, especially with metastatic colon cancer. COPD, copper peptide has helped people with lung disease. It protects lung cells. It increases SOD, superoxide dismutase activity. So that's antioxidant, anti-inflammatory. And here it is about the NFKB molecule, which is believed to be the primary cause of disease. It suppresses that, which is amazing. This is about the intracerebral hemorrhage that I mentioned. And here's the mention of injecting it around the skin. And look, the cost is incredibly low, just like the X39 is very low. So this is just going over the things we talked about. Okay, and then went for a patent for it. So it repairs our genes. It's anti-aging, converts older cells to a younger state. It helps with wound healing. Like tuning a piano, we need some maintenance. This helps us. So we patch it anywhere on the body, usually pick behind the top of the spine, behind the neck, or underneath the umbilicus. And it causes an upregulation of these molecules, the copper peptide. Humans glow. This is really interesting. This was a study done in Japan. They actually put people in a very dark room, and we put out light throughout the day. This idea of photobiomodulation, our cells put out light. We can't see it because we're in a lit area, but I think that was really fascinating. Okay, so the benefits, it's really can elevate naturally occurring compounds that declines with age, and that's where the similarities end. It's a first patch that elevates a peptide, copper peptide, which showed all the benefits before, and the results are really stunning. There's an immediate effect through an elevation of antioxidants and decreased inflammation. That's what we've seen in people. More energy, better sleep. People are having improvement in quality of sleep, and they're remembering their dreams. Pain relief. This is actually a text I got from my colleague Alan. He said, Adam, weird, yes. I said, how'd the patch do? He said, I had an epidural last week that failed. I woke up this morning, read online when he could get it done again. He said it went around 7:15. The nurses, 3 hours later, the nurses never saw me jumping so much. They actually commented on it. My back feels 75% better. I don't understand it. And he says, let's see, he said, I never want to take it off, he said at the end. So this was really interesting. He noticed this in about 3 hours. Certain people take about 6 weeks to have an impact. Certain people about a week. So there's a range, but it definitely helps a lot of people. This woman wore it for about a year, and see how her skin looks better a year later. Her name's Manny. This was fascinating. Sports performance. It helps people with their recover from sports. Hair growth. This is fascinating. This was actually a picture sent by someone showing that her dad's hair grew 6 weeks on the patch. Let me go back here, sorry. And this was interesting. This was, look on the right here. This person was working on rafters. He fell through the ceiling. He had broken ribs and a punctured lung, extreme pain. He expected to heal over about 6 weeks. He was on the patch, healed in about 3 weeks. Same with the finger tip regeneration happened. This woman had facial radiation. It helped her. You can see the dates there. So it speeds recovery. Brain health. This is interesting. It can actually help when we have too much activity or too little activity. That's not good for our brain. It helped make a more moderate brain activity with copper peptide. Scar removal. This was interesting. This was a patient who had a heart heart surgery, and they went through right through the chest there, and you could see that a year later the scar healed. It was indented, and then a month after using the patch, some of the scar actually filled in. This is another one like this. You could see it was put on the foot. You don't have to put it on the foot, but look, a month later, you see how much healing happened there with the foot after that incision there. And wound healing, and I was actually talking about how that helped me. This is a surgical scar 2 weeks later. Youth renewal, it's amazing. This is my book. I'm going to just go through once again. I can't say it helps specific diseases. I was showing you, this is my patients before, without a patch on the left, with the patch. And let's take you through the procedure. We use lasers to improve their skin. See how red they are without the patch, and with the patch, see how there's very little redness and the healing is much more advanced. At 10 days after surgery, my patients on the right, who both had the patch, looked like they were about a month after surgery, and the patient on the left is without the patch. And now keep going. At a month later, this is 5 weeks later, looks great, but these people at 10 days look as good as this woman looked at a month. So this was really amazing how this helped heal my patients. And I really want to thank you for your attention, and I hope you found this interesting. And you can definitely look me up, and you can get this book if you're interested. And thank you so much for your attention.